me live here in studio is Dr. Kenyani Davis, Chief Medical Officer at the Community Health Center of Buffalo. Thank you so much for coming in.
Thank you
It's good to see you. You were saying, you know, as we approach marking 2 years since this horrible tragedy, it is just a time that we reflect. Garnell Whitfield told me today, I mean, for the people who lived this so closely, it's an everyday thing. But it is an opportunity for the community writ large to take a moment, to take a beat, and to think about, you know, these important issues. What do you think has changed over the past 2 years?
I think one of the things that's important to understand is he's absolutely right. 514 is every day for some people, directly and indirectly affected. This didn't just affect a small percentage of people. This was a community, and not only a community, this was Buffalo. Because we have to remember, this was an outsider that came in. This wasn't somebody who was from Buffalo. And healing is important, not only for the survivors directly and indirectly affected, but healing for a community. And that community is described as Buffalo. And understanding that healing is not linear. It's a very convoluted circle that takes you 10 steps forward and 20 steps back and then catapults you forward. It's a process. And that's something that we all have to walk through. And I think over the past 2 years, that's what's happened, is that we've all walked through this journey of healing in our own way.
I know that you are very focused on health disparities that exist in different communities in Western New York. Have we that's sort of your specialty area, right? So I'll ask you, because there are many different disparities in different communities, but health-wise, how are we doing at trying to address that? Yeah,
and I think one of the things is we can do better, right? And understanding that really what we're dealing with is health inequities, because inequities are unfair and unjust. Those are made, those didn't happen by chance. And when you talk about things like 514 that happened, this was racially motivated.
Right. We don't say that often, right? We call it a mass shooting, not a racist mass shooting.
Right. It was a domestic terrorist event that happened, and we have to call it for what it is. Because if you can't define it, you can't address it. And I think being very intentional over the past 2 years of really describing what it is and understanding will allow you to be very intentional moving forward. And like I said, in understanding this is an entire community, and these disparities or inequities will continue always until we continuously talk about the divides that we have in Buffalo, the racial divides that actually caused all of this to happen.
On that note, I mean, addressing health disparities, right, I do want to ask you about, there are plans to expand services to the Buffalo Federation of Neighborhood Centers on Monroe Street in the city of Buffalo. How much of a difference can this make, and tell me about services there?
Yeah, so absolutely. So when you talk about somebody's health, and I always say that health is a composite of the mind, the body, and the spirit or purpose, wherever you may lay, but total wellness, especially as a community, all three of those things have to be lined. And when you talk about health, it's not about just building the building and the fancy entryways. It's about connectivity. We always talk about the paint on the walls and tile, and that's great. But somebody has to feel connected when they walk through those doors. I'm in the business of human experiences. And the social determinants of health make up 80% of the totality of somebody's health, right? Wow. My little stethoscope is only like 10%, right? So newsflash, sorry, guys, it's not me, right? It's urban planning, it's development, it's education system, it's reentry from prisons, it's financial stability. All of that makes up the totality of somebody's health. So what we've done is we've actually put medical facilities in places in the community. So instead of drawing people out of the community, we've actually listened to the community, put them in the community, and said, what exactly is it do you need? And me as an organization, let's provide that for you.
It's great to know that's happening. In the little bit of time I have left, how optimistic are you? It's a strange word to even use on a day that is so dark. But you hope, and Garnell told me this today, you hope that something good can come out of something so bad. Are you optimistic into where we're headed?
I'm a hopeless romantic always, right?
Great.
But I absolutely am optimistic, because the truth is when you come to a time like this, any and every day or thing can be triggering. And it's so important not only for people to understand that you just have to outlive your worst day by one day. And that's an important concept to understand, is because this can be heavy. this is one more thing on top of something. But I'm hopeful as long as we continue to still have these hard conversations, they can be a little uncomfortable, but we have to remember, you didn't do it, I didn't do it, but it's in our front steps. So it's all of our jobs together to pave a path forward. So
Dr. Kenyani Davis from the Community Health Center of Buffalo, thanks so much for coming in. It's great to talk to you.
Thank you.